Hi everyone, my name is Dr. Chen Yiming, and in this week's video, I'll be sharing about eczema, a very common condition that causes itchy and dry skin, especially in children. What is eczema? What are the causes of eczema? What are the symptoms and signs of atopic eczema? Treatment options of eczema and what you can do on your own at home. Watch till the end to learn all about it, and if you're new to my channel, click on the subscribe and notification button now. We hear about eczema all the time. It's basically a term to describe a condition where skin is inflamed and angry looking. It is a group of conditions which causes skin redness, itchiness, dryness, skin peeling, and sometimes pain and infection. There are many types of eczema. Eczema which are due to allergy, and these are called atopic eczema, and they are most common in children. Eczema which are due to dryness, they are called asteatotic eczema and are very common in elderlies. Eczema which occurs upon contact with something which you are allergic to or irritated by, these are called contact dermatitis. Eczema which tends to occur on your scalp, eyebrows, face and causes bad dandruff, these are called seborrheic dermatitis. There are probably 3 other types of eczema which are not as common. Today, I will focus more on atopic eczema, which is a very common condition in children. The exact cause and mechanism of atopic eczema is still not fully understood. However, it seems that this condition affects patients who have a family history of eczema or who are concurrently suffering from other allergic conditions like allergic rhinitis, asthma, or allergic red eye issues. Atopic dermatitis typically begins in childhood, usually in the first year of life. Most patients tend to outgrow them. About 70% of children outgrow atopic dermatitis by puberty. Unfortunately, about 10 to 20% of atopic dermatitis persists into adulthood. Patients with atopic eczema develops intensely itchy rash, usually on parts of the body that folds, such as the inner part of our elbows, the back of our knees, and the neck. But of course, it can happen on any part of our body. The itch is persistent and the skin is red and inflamed. It makes the patient scratch intensely, and as a result of the prolonged inflammation and scratching, the skin often discolors and thickens. Bacterial infection is common too, as the protective barrier of the skin is damaged due to the inflammation. What can the triggers of eczema and atopic dermatitis be? Stress, dryness of skin, heat and sweat, dirt and dust, allergens like dust mites, pollens and molds, and even chemicals like detergents, fragrances, and preservatives. They can be extremely uncomfortable and disabling to the patients, not to mention the impact it can have on the growth and development of a young child. Learning more about the condition and understanding the treatment options can be very helpful. The first step to successful management is to avoid the triggers. To the best of your ability, keep the environment as clean as possible. Avoid having items that can trap dust around the patient, like soft toys. Vacuum your house and bedroom regularly. Constantly wash the pillow and bolster casings and sun the mattress every 2 weeks to get rid of dust mites. Opt for gentle and hydrating body wash and avoid using fragrances and harsh detergents. Avoid clothing made of wool or nylon fabrics. The second step, and perhaps the most important step, is moisturizing. Moisturizing the patient's skin helps reduce dryness and itch, reduce inflammation, and restore the protective skin barrier. Choose moisturizers that are hypoallergenic without fragrances. Some of the ingredients that are beneficial include ceramide, urea, glycerin, paraffin, and hyaluronic acid. Application of moisturizers can be done liberally up to 2-3 times a day when required. The third step would be topical steroid creams. Steroid creams are helpful to reduce inflammation and calm down the skin. They help with the itch and the redness. However, prolonged steroid cream usage comes with side effects like skin thinning, discoloration of the skin, and may even affect the growth of the children if used in large amounts. As such, always seek a medical doctor's opinion on what type of steroid creams to use and for how long. So when should you see a doctor for atopic dermatitis? If you're unsure of the diagnosis of the itchy rash, please see a doctor. If you have already removed all potential triggers and have already applied plenty of moisturizer to your child but the condition is still worsening, please see your doctor as soon as you can. Or if there is a sudden worsening of the skin condition or even signs suggestive of infection like increasing pain, increasing redness or swelling or even blistering, then you will need to see a doctor urgently, as antibiotics may be necessary to treat bacterial infection. Understand that eczema is a long-term skin condition. Understand that the skin may go through good times and bad times like a roller coaster. However, remember that treatment is always available and the objective is to keep the skin in the good times most of the time. Seek help from your friendly family physician or dermatologist if the situation goes beyond your control. Thanks for watching till the end. Share this video with your friends and loved ones suffering from eczema. Subscribe to my channel. Until the next time, stay safe and stay healthy.